Chapter 9, picking up where we left off, talking about circadian rhythms. So changing from supine lying position to sitting or standing position causes the body water to shift from the intravascular to the intercellular components in the tissues. So enzymes, protein, lipid, iron, calcium levels are significantly increased with changes in the position. So this postural pseudoanemia is a posture-related condition with changes in the hematocrit and hemoglobin results, and therefore these values are extremely low compared to later in the day when the patient has been sitting or standing and have their blood recollected for the hematocrit and or hemoglobin. So sitting and standing leads to a net movement of the fluid. So this leads to a false anemia. The healthcare worker can be helpful in providing information on the patient's posture prior to collection. So age. Laboratory test results vary considerably during the stages of life. So blood cholesterol and triglycerides increase as the person ages. And this is primarily due to different hormone levels, also to the changes in a patient's physical activity as well. A mastectomy. Patients who have undergone a mastectomy, surgical removal of the breast, often have resulting lymphedema on the site of the surgery. The stagnant flow of tissue fluid in this area may make the patient more prone to infection. We covered this briefly in Chapter 7. Lymphedemous limbs should be protected from cuts, scratches, burns, and blood collection. So it's really, really important that we don't perform any of these, regardless of the time frame. It could be 10 years or 50 years. And these images show you various stages of lymphedema in the limbs. Edema is swelling, can be localized or diffuse over a large area of the body. Veins in these areas are difficult to palpate or locate, and the specimen may become contaminated with fluid. This image shows you what's called pitted edema, where if we were to depress the fluid, then shifts from the spot and causes a depression in the skin. We want to try to avoid these areas when drawing blood, as we might get contaminants of tissue fluid in our sample. Menstrual cycle. Menstrual blood loss is the single most common cause of iron deficiency anemia in women. We do not collect more blood than is necessary, so as not to increase the negative effects of additional blood loss during venipuncture. We generally will try to collect pediatric tubes to help minimize the amount we draw from a patient. Infections. Many patients have transmittable diseases such as hepatitis that can be passed from one patient to another. We're going to avoid touching the site for blood collection after the site has been cleaned, and the blood collection equipment should not be opened prior to the time of the collection. We want to open it and put it on a clean surface, so that way the patient knows that it is clean and fresh and new. Vomiting. We're going to have the patient take a deep breath and use a cold compress on his or her head if they feel nauseous. Inform the patient's physician or nurse of this complication. The other thing we want to be mindful of is we want to have water available to rinse the mouth unless the patient is not allowed to have water if they do vomit, and also to providing the patients with an area to potentially lay down. Identification discrepancies. So improper identification is the most dangerous and costly error a healthcare worker can make. Loss of life from acute hemorrhagic transfusion reactions, delayed diagnosis and additional blood collection and laboratory testing, treatment of the wrong patient for the wrong disease. Number one patient safety goal for the Joint Commission is through at least 2 unique identifiers, being the patient's first and last name and date of birth, one of which cannot be the patient's location or their room number. Please be aware that misidentification of a patient can lead to loss of life from an acute hemorrhagic transfusion reaction, delayed diagnosis and additional blood collection laboratory testing, and treatment of the wrong patient for the wrong disease. This is why it is super essential that we identify our patient correctly. Time of collection. Early morning specimens are commonly requested in a hospital setting because a fasting specimen is preferred. The healthcare worker is running late. The specimen must be collected after the inpatient has eaten breakfast and would require a special notation about the non-fasting condition on the requisition and the sample itself. When checking the requisition, we're going to match the laboratory tests requested with the appropriate type of collection tube. It's essential to minimize the amount of blood collected from each patient. Tourniquet pressure and fist pumping. Laboratory test results can be easily falsely elevated or decreased if the tourniquet pressure is too tight or is maintained too long. So pressure from the tourniquet causes biological analytes to leak from the tissue cells into the blood or vice versa. Some enzyme levels can be falsely elevated or decreased because of the tourniquet pressure, and that if it's too tight or prolonged. So we want to be mindful that it takes, we want to leave the tourniquet on no more than 1 minute. If it takes longer than 1 minute to find the vein, release the tourniquet for 2 minutes so the blood in the arm can return to the basal state for more accurate results obtained from the blood. Also, pumping of the fist before venipuncture should be avoided because it leads to an increase in the patient's plasma, potassium, lactate, and phosphate concentrations, as shown here. And fist pumping is the opening and release of the patient's fist. That is no longer advisable. We want the patient to hold a tight fist and then release it as we get blood flow. Failure to draw blood. Factors that may cause a healthcare worker to miss the vein. These factors include not inserting the needle deep enough, inserting the needle all the way through the vein, holding the needle bevel against the vein wall, or losing the vacuum in the tube as demonstrated in figure 9.2. If the needle bevel is against the wall or is not inserted deep enough into the vein, the fragile red blood cells will be hemolyzed due to the narrow opening for the red blood cells to enter the needle. To avoid these situations, the needle may need to be moved or withdrawn somewhat or redirected slightly. If the needle is inserted too high, greater than a 30-degree angle, the needle may go through the vein. For a traditional eclipse needle, our degree of angle is 30 degrees or less. For a butterfly needle, it is 15 degrees or less. Please be aware that geriatric patients, their veins may roll, causing the needle to slip to the side of the vein instead of properly being punctured in the center. So we want to make sure to provide a tight anchor. So these images, A is an appropriate insertion of the needle. This is where we're holding the bevel against the vein wall. We're going through the vein and we're at the back of this vein wall. We've went all the way through the vein and we could potentially hit the nerve or artery. E, we haven't went in enough, which is causing blood leakage or a hematoma to develop. F is an example of a collapsed vein, so the vein can't handle the pressure from the vacuum tube or the needle is too large. This is, we went through the vein at too high of a degree of angle again, and we went through the back of the vein wall. And H, we haven't even penetrated the skin. Searching by probing for the vein may cause damage to the patient's arm. We are allowed to redirect once. On occasion, a test tube will have no vacuum because of manufacturer errors, so we will want to check this. Partial draw tubes are available through some manufacturers. Please be mindful that if we're going to try to manipulate the needle at all, that we're going to show you how we change direction or try to save a misdraw, but you're only allowed to perform this once. Failure to draw blood. So again, defective tubes. On occasion, a test tube will have no vacuum because of manufacturer's error, age of the tube, or tube leakage after a puncture. Once the tube is engaged to the back of the tube holder, the vacuum is exhausted and cannot be used again. Needles for evacuated tube systems have been known to unscrew from the barrel during venipuncture, so we need to be mindful of this. Again, defective tubes. If this happens, the tourniquet should be released immediately and the needle removed and the procedure performed again. Backflow of anticoagulant. The patient's arm is placed in a downward position and the tube top is upmost position to avoid risk of backflow of an anticoagulant from blood vacuum tube into the patient's circulation. For hospital patients unable to extend his or her arm, they're going to raise the head of the bed and potentially put a pillow under their arm for support. Please view the clinical alert on page 298 in regards to patient fainting, and on page 299 in regards to a hematoma can occur when. Fainting or syncope is a transient and frequent sudden loss of consciousness due to the lack of oxygen to the brain. Syncope caused by a variety of factors: hypoglycemia or low blood sugar, hyperventilation, cardiac, neurological, or psychological conditions, and medications. Many patients become dizzy and faint and get weak in the knees at the sight of blood. A fear of blood phobia is a common psychiatric disorder that occurs in 3 to 4% of the population. So therefore, we need to be mindful in putting the patient in a director that has a locked armrest to avoid the possibility of the patient falling. We will also, in our interview, ask the patient, have they had their blood drawn before, and if so, how'd it go? That will also give us an idea of if we need the patient to lay down for the procedure. Healthcare workers aware of patient condition throughout the collection procedure. Ask the ambulatory patients if they tend to faint or have previously fainted during the blood collection. If so, they should be moved from a seated position to a recumbent position. If the seated patient feels faint, the needle should be removed. Patient's head should be lowered between the legs, and the patient should breathe deeply. The healthcare worker should stay with the patient for at least 15 minutes until he or she recovers, until a nurse or physician can take over. A wet towel gently applied to the forehead, a glass of juice or water may help the patient feel better. Please be mindful if we're giving the patient juice, we also want to determine that they are not diabetic. Hematoma. A hematoma can occur when the needle has gone completely through the vein. Bevel opening is partially in the vein, and the patient's vein is fragile and the needle is pulled out of the vein while the tourniquet is still in place. Please make sure to read the clinical alert on page 300. This is an example of a really bad hematoma. The healthcare worker fails to hold firm pressure, or the patient's hold pressure over the venipuncture site. A blind stick inability to see or palpate the vein is performed, or the healthcare worker probes for the vein. These are the areas we want to avoid when drawing in excessive hematomas, because there is coagulated blood that could affect the test results. Petechiae are small red smooth hemorrhagic spots appearing on the patient's skin, indicating that minute amounts of blood have escaped into the skin's epithelium. This is a complication as a result of coagulation abnormalities such as thrombocytopenia, which is a low platelet count, and should be a warning that the patient's puncture site may bleed excessively. The other thing it can occur in is febrile illness, and also can be caused by fair-skinned patients. Excessive bleeding. Patients on anticoagulant therapy and are those taking high dosages of arthritis medication or other medications may bleed for a longer period. Pressure must be applied to the venipuncture site until bleeding stops. Nerve complications. If the healthcare worker accidentally inserts the needle all the way through the vein, he or she may hit the nerve below the vein. Patient most likely will have a sharp electric tingling and painful sensation that radiates down the nerve. Discontinue the procedure and complete an incident report right away if this were to happen. We're going to provide an ice pack and apply it to decrease inflammation if this action is advisable by your facility. Seizure during blood collection. This is a rare complication. Immediately release the tourniquet, remove the needle, move the patient to a lying position. If he or she has not fallen already, attempt to hold pressure over the blood collection site and call for help from the nurse's station. No attempt should be made to place anything in the patient's mouth unless the healthcare worker is experienced and authorized to do so. Hemoconcentration. Decrease in the plasma volume with increased concentration of cells and larger molecules caused by prolonged tourniquet application longer than 1 minute. Massaging, squeezing, or probing a site. Long-term IV therapy, sclerosed or occluded veins. These will cause possibility in laboratory errors because it affects red blood cells. It could also affect the cholesterol levels of a patient. Intravenous therapy or IV therapy, the arm with the IV line should not be used for venipuncture because the specimen will be diluted with IV fluid. If unavoidable, the IV line should be shut off for 2 minutes by nursing staff or a physician. Then the blood specimen may be collected below the IV site. Sometimes the nurse or physician can disconnect the IV line and collect blood from the line that is already inserted, but this is done by a trained healthcare professional. It is recommended that if they are going to draw from the line of an IV site, that the lumen is cleaned, flushed with 5 mL of sterile saline, and discard volume withdrawal. They're going to discard about 5 to 7 mL of blood and then provide you with the rest. Collecting a blood specimen from above an IV that has been temporarily shut off is not recommended because of the possibility of analyte contamination. It should be documented that the area from which the specimen was collected was below the IV site. Alternatively, sometimes the nurse or physician, again, could disconnect the IV to draw from it. We're also going to document on our paperwork that the specimen was collected below an IV site. So a first few milliliters of the specimen should be discarded to remove the IV fluid. The other thing to be mindful of, a note should be made on the laboratory requisition that this step was performed. Hemolysis, this results from the red blood cells are lysed. Hemoglobin is released and serum, which is normally straw colored, becomes tinged with red or pink. Common causes: connection of blood collection equipment parts are too loose. Tube choices are not based on the patient's vein. The syringe plunger was pulled too fast, or prolonged tourniquet application, longer than 1 minute. Some other common causes: too small or too large of a needle is used. Needle readjusted. Needle blockage occurs to the bevel being against the vein wall or improper angle of the needle. Tube shaken or mixed vigorously rather than gentle inversions. Blood collection performed before the alcohol dried at the collection site. Improper blood collection from peripheral IV catheters or central lines. Syringe collection made without the quick transfer via the blood transfer device. Sluggish or slow blood collection can result in hemolysis in an underfilled tube, and lack of proper handling and transport after collection. It can also be caused by the result of physiological abnormalities. Hemolysis causes falsely increased results for many analytes, and hemolysis also shows decreased red blood cells, hemoglobin, and hematocrit. Please see box 9.4 in your textbook that goes over this in more detail. Collapsed veins. A vein that's collapsed when the blood is withdrawn too quickly or forcefully during the venipuncture is shown here. Common in geriatric patients. A collapsed vein should not be probed with the needle. Again, this can cause the vein to basically disappear. Improper collection tube. Learn which common laboratory tests require which collection tubes. Be familiar with how and where to seek this information, either electronically via laboratory reference manuals about tests and tube requirements, and use of improper blood collection tubes can affect specimen quality, analytical results, and patient safety. Just as a reminder, and I want to go back to talking about hemolysis real quick, recently through the CDC study, it was verified that since low blood tubes have less vacuum, the red blood cells are subject to far less pressure when filling and blood collection are less likely to rupture and decrease the causes of hemolyzed samples. So if we notice the veins are really small, we might want to opt for that pediatric tube. On page 303, examples of blood specimens collected in the Rahn tube or Rahn manner follow. Please review items 1 through 11. The other thing, the risk of specimen rejection due to underfilled blood collection tubes can be avoided by holding the blood collection tube in place in the tube holder until blood has completely stopped, filling the tubes to their stated blood volume, or filling to the minimum fill indicators on the tube if indicators are provided. And also please read the clinical alert on 303. I just want to stress again, under the examples of blood specimens collected in the Rahn tube or Rahn manner is the number 3. The light blue top tubes with sodium citrate for coagulation testing must not be underfilled because coagulation test results will be falsely prolonged, leading to errors in anticoagulant therapy. If the healthcare worker is collecting blood only for a PT level, it is recommended, again, if they're using a butterfly, to have a dummy tube in its place. Please make sure to review these, as this is essential. There is not a slide on this, but it gives you some more background information on what can happen if the tube were to be underfilled, and what could happen to the test results. So for example, I'm going to go over one other one, number 9. Blood culture bottles cannot be underfilled because the detection of microbiological organisms and bacteremia and septicemia will be delayed, therefore causing us to have to recollect a sample and delaying the patient's diagnosis and treatment. This concludes Chapter 9's narrated lecture PowerPoint. Please make sure again to review the study questions, case study, and action and practice at the end of this chapter to prepare for the chapter test.